Out front now, Dr. Jonathan Reiner, director of cardiac cath lab at GW, who advised the White House under President George W. Bush, and Dr. Ashish Jha, director of the Harvard Global Health Institute, the testing expert. Dr. Reiner, so the president goes from, I'm not going to let anyone see me in a mask and give them the pleasure and wouldn't wear one, to now everyone needs to wear a mask. He went from, we have it so well under control, it's going away, it's minuscule, it's gone, it's leaving, to it's a terrible disease. He said the former comments on these things for 5.5 months, and he's now saying the latter for a few days. But the press secretary says there's been no change in tone. What does that do to public trust?
Well, it erodes it. Words matter, and the words of a president matter a lot. Erin, when I see a patient after a heart attack, when I see them in clinic, I weigh my words very carefully because I know they're listening. And if I need the patient to lose weight and get their blood pressure under control and stop smoking, I say it explicitly. But for the first 4 to 5 months of this pandemic, the president said that testing was overrated, that masks weren't for him, that the virus was a hoax or was going to go away. He felt it appropriate to hold rallies in pandemic hotspots. His words and actions resonated through the country. And that's why the virus is raging through large sections of the South and West. The words of the president matter. We need an unequivocal voice from the president of the United States that says the following: every American needs to wear a mask. We need a president who gives cover to governors to close down if the virus is out of control in their states. We need a president who says we will not open schools if it's not safe to do so for the children, the teachers, and the parents. We need an unequivocal voice from a leader in Washington. And if the president is going to do that, I'll stand up and applaud him.
So Dr. Jha, how much, on the example, even this week, he's still trying to say that the only reason there's more cases is that there's more testing. And obviously the math does not show that, right? As testing has increased. And by the way, not enough. And you get to wait 10 days to get your results in some places. So, that's a whole separate issue. But the number of cases, obviously, it dramatically exceeds that. So how much further do we need to go? And what could he do now to fix it?
Well, we're really in a very difficult spot right now. So we have a long way to go, both on testing and just getting the disease under control in general. I think it's worth understanding that we are the global hotspot right now. Much of the southern United States is generating a large proportion of the cases around the world. So we have a lot to do. I am deeply worried about our testing infrastructure. It is hitting the wall and it is starting to crumble. And we're seeing that in delays in returns. We're seeing that in machines starting to break down. We're seeing that in how hard it is for people to start getting tested. So we need a reboot, Erin, and we really need the president. The words are very important and I'm happy to hear them, yep. But we want to see that followed with actions from the White House to create a true national testing strategy so that Americans, when they get sick, can get tested and get results quickly. And that'll be an important part of bringing this disease under control.
So, Dr. Reiner, I want to play something that Dr. Fauci told David Axelrod about his own safety. It's a pretty stunning kind of exchange. So let me just play it for you in full.
Back in the day of HIV, when I was being criticized with some hate mail, it was more people calling me a gay lover and what the hell, you're wasting a lot of time on that. I mean, things that you would just, push aside as being stupid people saying stupid things. It's really a magnitude different now because the amount of anger, I mean, as much as people, inappropriately, I think, make me somewhat of a hero, which I'm not a hero. I'm just doing my job. There are people who get really angry at thinking that I'm interfering with their life because I'm pushing a public health agenda. I mean, the kind of not only hate mail, but actual serious threats against me are not good. I don't really see how society does that. But
yeah, how do you process that?
It's tough. I mean, it's tough. I mean, serious threats against me. I mean, against my family, my daughters, my wife. I mean, really? Is this the United States of America? But it's real. It really is real.
Have you had to take on security measures and so on?
Yes. I've been given security.
I think Dr. Reiner says, is this the United States of America? but it is, but it's real. What do you think when you hear that?
It makes me both angry and really sad. Tony Fauci is a scientist. He has devoted his life to science. He's devoted his life to trying to cure the most dreaded diseases of our time. But he's been demonized because he hasn't hewed closely to the orthodoxy of this administration. He's simply tried to tell the truth. During that same, during an interview that the president had today, the president said that Tony Fauci wants to keep states closed for 2 years. Tony Fauci's never said that. But when the president parrots that kind of nonsense, it resonates through the lunatic fringe. And that's what generates this kind of hate and danger to a patriot like Tony Fauci. This kind of anti-science message is very destructive. Look, I'm worried that once we succeed in creating a vaccine or vaccines, that we're going to have to go a long way to convince large parts of the country, the same parts of the country that generate hate mail to Tony Fauci. We're going to have to convince them to actually take the vaccine.
Yeah, which is terrifying. I mean, Dr. Jha, there's something else Dr. Fauci said today about this challenge to science, right? To people who are out there right now trying to save lives, public health officials. Here's what he said.
Often the evidence and the facts are not readily acceptable by some people who push back against it. You just have to stick by your guns. Don't get involved in any ideology. We are not politicians. We are public health officials.
So, Dr. Jha, what are the repercussions for the country when, someone like Dr. Fauci is getting death threats and pushback like this, that he has to try to tell the people for him to don't let the politicians do this to you. Just do your job.
So, Aaron, I think this is possibly the biggest problem facing America right now. The reason we have almost 1,200 Americans died today. The reason we are in such deep trouble is because of a campaign of misinformation, largely through social media like Facebook, but propagated by political leaders. And basically, it confuses large chunks of the American people. And the point of leadership is to clarify that and to suppress and push back against misinformation and talk the truth to the American people. And that has not happened from many of our political leaders. And so it has been left up to people like Dr. Fauci. And I'm sure Dr. Reiner has felt this. I have felt this, that we've spent enormous amounts of time fighting misinformation instead of fighting the virus. And that makes us much worse off as a country and as a people.
Yeah, it's cost us many, many lives. Thank you both very much.